here's my position. To get back to anatomical position, I need to put my feet about shoulder width apart, feet facing forward, and put my arms at my side and my palms facing forward. Should look like this. From the side, this is what it looks like. Palms are facing forward. The planes of the body. This is the mid-sagittal plane. It is vertical, and it goes through my midline. Sagittal plane is also vertical, and it could be placed at any point as long as it's facing the same direction. The coronal or frontal plane is also vertical, but it is perpendicular to the mid-sagittal plane. The transverse plane is horizontal, it goes across, and it is around the midline where it starts. The oblique plane goes at an angle, so this would be an example of an oblique plane. Some regions of the body. First is the axillary region, or the armpits, and then there's the mental region, or the chin, and then there's the femoral region, or the upper leg, named after the femur, of course, the sternal region, which is in the center of your chest, the buccal region, or cheeks, and then there's the orbital region, or your eyes, and then there's the dorsum of your hand, or the top of your hand, and then the dorsum of your foot, or the top of your foot, and then there's the antebrachial region, or the forearm, and then there's the carpal region, or the wrist. And then there's also the scapular region, or the shoulder blades, just to name a few. And then proximal versus distal, or superior versus inferior. So as of right now, my axillary region is superior of my dorsum of my hand, meaning it's higher up. But if I go here, then that becomes inverse, where my axillary region is inferior of my dorsum of my hand, meaning the dorsum of the hand is higher. But no matter what, if I'm hand reaching up to the sky, if my hand's out to the side, or if my hand is down, the dorsum of my hand will always be distal to the axillary region. The axillary region is proximal to my body compared to the dorsum of my hand, because proximal means closer to the point of attachment,